Hey guys, Anthony Carey with Core-Tex, hip mobility. Such a big topic right now, so popular in what we're seeing online, and actually the need is there, right? So that's why it's so popular. We see it in our golfers, our tennis players, all our athletes, as well as our everyday folks, because hip mobility has a dramatic impact above and below those joints and the influence of how we're able to move and how we dissipate stress and force. So many different techniques out there. There's a lot of great stuff that's being done working on hip mobility. Some of it just takes too long. Some of it puts people in some uncomfortable positions. You combine it with self-myofascial release, a great aspect to the process, but ultimately we've got to move to make it happen. One of our underlying philosophies, and what we feel is scientifically valid, is the idea of these gentle oscillating motions, of course, and using multiple vectors from which tissue is actually impacted in. So whenever we just try to work along one vector, we can improve that aspect of the tissue. But what about all the accessory vectors that are involved as well, that ultimately leave where some sarcomeres are short and some are long in any given muscle, depending on the joint position that we're in? One of the beautiful things about Core-Tex is it provides that opportunity for you to access all that, right? So getting back to hip mobility, our topic at hand, one of the things that we often use here at Function First and our ability to somewhat objectively measure hip rotation. Granted, it is not pure hip because we get mid-foot, forefoot, we get the rear foot, we get a little bit of knee, and then we get the hip involved in terms of what we're looking at. But the sum of those integrated parts still gives us a net output, right? So where am I in? We've got this great little grid that we use that's from Total Gym. We have the person, we'll look at their internal or look at their external rotation, we'll use the measurements. We have people that buy Core-Tex just for hip mobility, right? So what I want to share with you today is how we can take 3 movements that are typically considered sagittal plane exercises or sagittal plane mobility moves if they're done on the ground. And if we use Core-Tex, okay, we can access the aspects of those traditionally thought of sagittal plane tissues, okay, how they influence the transverse plane, okay? So if we were to do 3 exercises, we're going to do our one joint hip flexor, we're going to do our hamstrings, and then we're going to do our kneeling hip flexor, okay, or our 2 joint hip flexor. And what we'll do, just to put a little bit of systematic process to it, because subjectively you can play around with this if you want, but if I were doing my left hip, metatarsal heads on the logo, we're going to take the other foot and put it up so that we're uncoupling the hips. So from this position, one of our golden rules with the mobility aspects of Core-Tex is I want to take the slack out of the tissue, right? We don't need this giant motion of the Core-Tex to be able to achieve what we want to do if we take the slack out of the tissue. So keeping your Core-Tex centered and floating, I'm going to bring my hip into some extension, maintain this position. So if it's a client or an athlete or a patient, I'm going to say, out of a little, medium, or a lot, I want you to feel a sense of a medium or mid-degree stretch on the hip flexor, okay? So again, primary plane that it's known for is this. So here's our systematic way of doing it. I'm going to have you do 10 times in the sagittal plane, front to back, okay? There's our oscillation with the hip flexor lengthened in the sagittal plane. Then we're going to do 10 times in the frontal plane, side to side. I still got that pre-stretch in the sagittal on, and then I'm going to do 10 times where I'm going to circumduct the hip, okay? And I can do 10 where I'm going clockwise, 10 going counterclockwise. Both of them actually affecting the hip in both rotational, but the primary is on the muscle associated with the sagittal plane. After that, what we're going to do is we're going to do the hamstrings. So from here, I'm going to put my heel down, I'm going to dorsiflex. Now we're influencing the leg that's not on Core-Tex. Okay, so toe back, quad tight, little hip hinge, little medium or lot. There's a medium stretch in this right hamstring. Again, 10 sagittal, 10 frontal, 10 transverse. With the transverse, the biggie is with the relative internal rotation of this hip. Okay, and then finally, we're going to go to our 2 joint hip flexors. So here, I'm going to put my knee on the logo, right? And again, same thing. I can use the handrail here for a little bit of stability, get the pre-stretch on. So I've taken the slack out, 10 sagittal, 10 frontal, and then I'm going to circumduct this one 10 times, and I'm going to circumduct this one 10 times. I can guarantee you, in a matter of 3 minutes, you will see a significant increase in your range of motion. Why is that? It's two primary reasons. A, we've accessed the tissue in ways. We've brought heat to the tissue as we're doing that. And more importantly, though, the nervous system has recognized that this is a safe area to go and is not going to resist what we're trying to do. So if you're going to get some hip mobility out of using your Core-Tex, and again, this applies to anything that we do from a mobility standpoint, those golden rules, where we put the tissue under some length and then we access it in along different vectors to influence the tissue that way. This is a great, both just as a restorative move, it's even a good activity prep move, okay? So for any of your rotational athletes, any of your back pain patients, okay, that you want to improve hip mobility on, I can guarantee you that you're going to see significant improvements immediately. And what we would suggest you do is you do a before and after. We do this all the time at trade shows. We take folks, we see what their hip rotation is like, we take them through that, and we retest them, and there's always an improvement in it, okay? For many reasons, but the big one is because of what they just did on there. I suggest that you play around with this a little bit, follow those guidelines on what you want to do, make it simple, and you're going to see significant improvements in the mobility aspects of what you're doing with your Core-Tex. Thanks for watching, guys.